Hi, I'm Dr. Henry Black. I'm a clinical professor of internal medicine at the New York University School of Medicine and president of the American Hypertension Society. I'd like you to do me a favor. Go to a bookstore. Doesn't have to be a big one, it could be a small one. Go to the health section. Most of what you see is about diets. And this person has this kind of diet, that person has another one. It's all over the newspapers, it's on the Oprah show. Depends a little bit on what they're emphasizing. And this has a very important impact on patients because someone is recommending a low-fat diet. Someone's recommending a high-fat diet. Someone's recommending a low-carb diet, high-protein diet. The consumer is got to be confused, and any of us who try to lose weight know that we're consumers of that as well. Well, this lends itself to the randomized clinical trial, but it's hard to do. Well, thanks to our colleagues Frank Sachs and George Bray at the Brigham and Women's Hospital in Boston and the Pennington Center at Louisiana State, we finally have a good answer about, is it what you eat, or is it how you eat it, or is whether you stick with what you get. So over 800 people were enrolled in a randomized clinical trial of 4 diets. 2 were low fat, 2 were high and low protein, 2 were high and low carbohydrates, and they used a factorial design so people would get low fat and high carb, low fat and low carb, and so on. This was a 2-year study with very good ascertainment and an enormous amount of support. People went to counseling sessions 3 to 4 times a month in the first 6 months, and then 2 to 4 times a month for the additional 18 months, plus individual sessions. This is something that very few of us could ever afford to do with respect to time, with respect to cost, and most practices could never do this. But you gotta test things under the best circumstances. The group averaged about 50 years of age. A reasonable number, about 35%, had metabolic syndrome, some of the risk factors, and they were all very, very eager to lose weight. Just the people you'd want to study. The main objective of this was to see how much weight would be lost on any of the components of this diet, the so-called macronutrients. Well, at 6 months, all of the diets were successful. People lost about 6 kilograms, and there wasn't any one diet that was better or worse than any other. And like every single other dietary program, from 6 months to 18 months, or actually to 24 months, 18 months additional, the weight started to go up. So at the end of that time, the weight loss was about 4 kilograms. Lost about 1/3 of what you gained. Cardiovascular risk factors improved with all of them. The low-fat diet did a little better for elements of the metabolic syndrome, especially the lipids. But at the end of the day, no one diet, none of them, was any better than any other. What they did learn from this very important study, and I think a landmark study in my opinion, is that what mattered most was your commitment to that diet. How many sessions did you go to? How often were you there? When did you skip them? And that was the major correlate between what diet you got and whether or not you lost weight and maintained it. Some people lost a lot of weight. Some people lost over 10% of their body weight. Some people lost 20 kilograms. Very impressive results, but these were few. A reasonable number lost about 5%, but the important thing here isn't that you stick to this diet or some other diet, it's that you stuck to something. One of the things that intrigues me is if all these diets work equally well and people get sort of sick of it and bored with it at about 6 months, why don't we try changing the diets? So for 6 months you're on a high-fat diet with a low carbohydrate, and then the next 6 months you change those. So you're not bored and you're not sick of it and you go back to something that people can do. Once again, as I've said earlier, I think our behavioral therapists have failed us. They haven't taught us how to get this to work. And unfortunately, we don't really have any other options right now. All of the pharmacologic approaches to losing weight just don't seem to work or are not safe. So we've got to learn how to get people to stay on a diet and how to make it work. If it does, we can anticipate extremely good results with respect to reducing events, cardiovascular events, MIs, strokes, heart failure, and all the things we associate with having an elevated blood pressure or an elevated cholesterol or a higher weight. So go out there and talk about it and get patients to stay on what you put them on. Thank you very much.